Before the government and State House of Assembly in Kano abused that could guarantee the safety of women and children. While we await the negotiations, deliberation and assent to these bills, the cries and plight of women who are victims and survivors reverberate around communities here in Kano. On this episode of Community Forum, we're going to be examining how the government can address some of these challenges. Welcome to the program. I am Sarah Ayuku. Are just some of the troubling stories of the ordeals and violence women and girls go through in different communities in Kano State and across Nigeria. 45-year-old Salamatu Aliyu is the only person they can run to in the community. Having passed through such experience herself, she is offering succor and guidance to many young girls who have experienced one form of violence or another.
I am a trader, but I decided to offer assistance to girls who need help in this community. I see myself as their leader. It was forced marriage that prompted me into doing this for girls. I was also a victim. I was not ready for marriage, but my father insisted. After my first child, I ran away from my husband's house in Jos because I didn't want the marriage. The man was not my choice as a husband, but my father arranged everything. The more they took me there, the more I ran away. I could not stay in the marriage. I was unsettled till the marriage was dissolved. My parents assisted me to repay the dowry, but left me alone. I went back to Jos, where I remarried when I was ready. In the first marriage, I was just a child, and it was forced on me by my parents. In this community, men are more powerful than women. Once they see a match, they force you to get married. If you refuse, you would be the loser. We want the government to assist us with girl child education. This will empower girls to stand up against forced marriage. We admire girls who are educated whenever we see them, but most of our parents don't know the benefits. If I was educated, I would have been better off. I decided to send my daughter to school rather than forcing her into early marriage. Since I didn't get education she must have, she is in secondary school in Jos. But what I get in return is insult from the people. They insult me for not letting her get married early. I just ignore them. When she is through, then she can get married and the husband must agree to let her continue her education. In many cases, the victims of gender-based violence have to face many sexual and reproductive health consequences, including unwanted pregnancy, unsafe abortions, traumatic fistula, sexually transmitted infections, and sometimes death. It is a problem that has got many people talking.
We need help in the healthcare system to provide adequate care to pregnant women and children. When women come to give birth, no one attends to them, despite the fact that we have a hospital in the village because there are no health workers. Many women in this community give birth at home, while some are taken to private hospitals. Men help out financially, but I want the government to provide health practitioners, skilled birth attendants, and others. There has been a huge improvement in girl child education compared to the past. Street hawking has also reduced. Here, about 2 out of every 3 girls go to school. The remaining 1/3 are the ones that hawk, and when they get back, they attend the evening Quranic schools. The age of marriage for a girl is about 18 to 20 years. There has been more awareness and development in that aspect. Some of the girls continue with their education.
The trend, the prevalence in northern Nigeria is extremely high. Some of the cases are not known, but I know that Nigeria accounts for the highest number of VBF globally. Yes, with about 400,000 to 800,000, that's the estimate. We have children or women or girls that physically they are not fit for pregnancy. Some of even the girls end up dying or being wasted like that. Some even end up having mental issues. We've had a lot of people I know in the north that are fighting for this. Now, everything is gradual, and we hope that with time, we would be able to accomplish. The first thing is, if you prolong the years of girls in school, you're most likely going to save, if not all, a large number of it. Because by the time they finish secondary school, most of them will be physically fit for whatever it is that happens in the marital home. So this is the problem we have. And if you say Kano has the highest, it's not because Kano is the worst or because Kano is not fighting this, but you have to attach everything to the population. Let's work on our economic, socio-economic, let's uplift that. And then I tell you people, because they're giving out their daughters, some of them, not because they want, but because they reduce the burden that they have. These girls are not gonna go to the farms. It's either they do that, or they send them for hawking. 98%, these girls are being sexually abused. If we can convince them to keep their girls in school till after secondary school.
This facility takes care of 10 communities under one ward.
So this is the only bed you have in the old facility?
No anyone. Say one like this, like what?
No any other.
No.
Asibitin nan muna buƙatar abubuwa da dama haka. Babban matsalar da muke buƙatar a wannan asibitin da ya fi ci mana tuwa.
We need a lot of assistance in this hospital. We lack basic storage facilities to store our equipment. The refrigerator we store things like syringe is bad, and we walk several kilometers to get the ones we use. We need beds and other furniture like desks.
4 zuwa 5 haka, sannan mu ɗauko allura mai aikin da muke da ita na asibiti, sannan kuma in mun tashi rago mu ƙara komawa da ita.
We are all short-staffed at the hospital. The woman in charge of the maternity ward is the only one attending to pregnant women. Even the head of the hospital is the only one in that office. Just 3 people attending to many patients. Most times, one person can attend to 25 children in a day. These same people will still attend to 30 to 45 patients daily.
Kula da ɓangaren mata masu zuwa awo haka kusan ita kaɗai ce.
This is the only hospital in this area, serving 3 communities. We lack the potable water we need in this hospital. Most of the pregnant teenage girls around here deliver at home. When you ask them to bring some materials they need, they go away. Most of them that are referred to other hospitals will rather go and deliver at home. Most of the pregnant girls who come here for care are mostly below 18 years.
As the population of the state continues to increase, there are efforts to stem the tide of gender-based violence, and for Kano State, which has 44 local governments, there is just one place where victims of sexual violence can get their rehabilitation needs attended to. It is the Waraka Sexual Assault Referral Center here at the Murtala Mohammed Specialist Hospital. It was established in 2016. There are posters that condemn sexual and gender-based violence at every corner. The Waraka Sexual Assault Referral Center is supposed to function as a shelter for survivors of sexual violence, a forensic evidence extraction point to be used in court, and to generally offer psychosocial support for survivors. But it is overwhelmed, catering for survivors living within its immediate community and many others who have to travel several kilometers down here to access its services.
With the recent creation of 4 additional emirates in Kano State, and then the upgrading of all the general hospitals in those emirates, the hospitals to general hospital in those emirates, His Excellency, the Executive Governor of Kano State, has approved the building of more of these centers in each of these general hospitals as a first step. You know, in Murtala Mohammed Hospital, like I told you, they were given a section where they are using. But in these new general hospitals, they are going to have their own independent center built as a first step. So we are going to have like 5 in a very short time. But those, it will not be enough, but at least it will bring those centers closer to those people in the rural communities.
Dr. Nasir Garko is the center manager of the Waraka SAC, and he tells me that the place is in need of urgent assistance to ramp up its services.
It was established in November 2016 with the support of Justice for All, a DFID funded program. The main activities, the center is under 3 ministries: the Ministry of Health, Ministry of Women Affairs and Social Development, then the Ministry of Justice. The Ministry of Health provides the space for the center at Murtala Mohammed Specialist Hospital. It also provides the doctors and nurses and also some consumables that will help in rendering the activities of the center. The Ministry of Women Affairs provides the staff for counseling the clients and their families, while the Ministry of Justice takes part in the legal action of the client. After the case was transferred to the court, they will continue with the proceeding. So as the name implies, Sexual Assault Referral Center is a center that is taking care of the victim of sexual and gender-based violence that happen here in Kano and other neighboring states like Jigawa, Kaduna, and some part of the Katsina. So the center is operating from 8 a.m. in the morning to 4 p.m. The beginning of the center, that's by November 2016, we have a total of 31 clients that were attended at the center. But with the increased sensitization and awareness, there is increase in the number of clients that are attended in the center. So there are some months we can get an average of 60, 80, 70, and there is even the month that we got a total of 90 cases per month. So from the beginning of the center to December last year, we have a total of 4,358 clients that were attended at the center. We also have some underage, that are about 12 to 13 years, that they present with pregnancy, they cannot deliver. Then at the end, we deliver them by cesarean section. Even last 2 weeks, we have one 13 years old that were raped, and we deliver her by cesarean section. Actually, the center is not enough because even those that were attended within this metropolitan local government, 6 local government, they are enough for the center. And you know, in Kano, we have about 44 local government. So if you consider the distance, people are suffering sometimes from Dogwa, sometimes from this close to Jigawa, from Takai, Kachoko, they will all be referred to this place. So at least we need some additional centers, at least in each of the 3 senatorial districts, so that the client will easily access the services of the center without any suffering before coming to the city. We need support from the government, so we are pleading for the government to come and assist the center with additional staff, because we have only 2 doctors at the center now, and we have only 1 nurse, and 3 counselors. So we need the government to help us with the support and also to provide additional staff so that they can be able to take care of the clients that were attending the center 24 hours.
Just before we left the center, another case has been presented. This time, a 70-year-old man is alleged to have sexually assaulted 2 children. But what about laws and policies to protect the most vulnerable and punish convicted offenders? For more than a decade, the Ministry of Justice has tried revamping the laws, particularly the Child's Right Act. The act has passed its 2nd reading at the State House of Assembly, but the VAT Act is still being formulated to suit the culture and religious nature of Kano State.
The Child's Right Act, exactly. It has been pending for almost 10 years. But when I came in as Attorney General and Commissioner for Justice, I ensured that it saw the light of the day. We prepared a memo. We did all that we could to make it work. Prepared a memo, took it to the Executive Council, convinced the Executive Council, of course with the support of His Excellency. It was approved by the Executive Council. Now it has passed the 2nd reading at the Kano State House of Assembly, and at any given time it's going to become law. I believe that is indeed a milestone in the history of Kano State, because for the past 10 years that there have been a lot of issues on that. And then of course the VAB Act. The VAB Act also, we have gone a long way. What we did was to consolidate it with our own penal code here. That too has been done, and in a very short while it will be presented before the Executive Council.
Access to justice and support remains a challenge for victims, and many times perpetrators walk free because survivors want to avoid the stigmatization that may come with them revealing what happened to them in their communities.
We are doing our best, but I assure you, out of every 10 cases, hardly you have 3 that end up in court. We have been talking to our leaders in various communities, been talking, the Hizbah also is there, the ward heads are there. All of them, we have been talking to them to enlighten the general public that, look, the issue of stigmatization is not something that should prevent a parent from coming out with his child. Out of every 50 cases, you find that 45, 46 involve children of not less than 3, 4, 5, 6, 7 years. What is happening, is the issue of stigmatization. Most of our people are afraid of coming out. Once their daughter is raped, they do not want to bring that issue out for general knowledge. If you tell them, look, we need to prosecute this person, we need to take this person to court, he needs to face the wrath of the law, mostly that is not what is worrying them. What is worrying them is the future of their child. They feel that if they come out, if she testifies in court, she may not be able to get a husband. The government is doing a lot on sensitization. Is doing a lot to protect them.
It is a cry for help from here, and all eyes are on the state legislature to formulate and ensure the speedy implementation of laws that will uphold the rights of the girl child and cater for the actualization of women's rights.
2 of them.
It's very rare.
One married to a 70-year-old.
But I'm not saying that, but since I started progressing.
So she's taking care of, she has 2 children, no? She's taking care of the 70-year-old man, because of course 70-year-old man cannot really do
exactly.
Talking about the actions or inactions of the state government, or Kano state government, and the assembly on issues relating to child violence, molestations, and issues like child labor and others among the vulnerables. You see, if you go through our records and what is happening from the state government, the assembly and the state government have been collaborating to ensure things like this are stopped. And typical example is the issue of enactment, of a bill which becomes a law that makes education compulsory and free in Kano State. This is one of the strong pillar of this administration, and it was done with the belief that some of these dropouts or some of these kids that are out of school due to economic vulnerability of their parents, and that is why the state government made it compulsory that every child must go to school free, compulsorily and as well as free. Then the other thing is that in the state assembly before now, just like what is happening in some states that are trying to domesticate the Child Right Act, the Kano State House of Assembly is also involved in similar process. We have gotten the Child Right Act before the House, and it has been committed to the Committee on Women Affairs. There are peculiarities, there are issues, cultural and religious issues, that should be put into consideration in domesticating the Child Right Act.
The state government is making a lot of taking a lot of steps towards curbing this menace. The only problem we are encountering is the area whereby developed countries assume that the child age or the child begins at up to 18 years, while our value and norm of the society believe in that a girl should get married at the age of 13 years. Something that one is born and brought up often is not easy for one to erase it from the word go. Care has to be taken, since from the word go, our ancestors believe that a girl can be married to somebody at the age of 13 and delivered even at home. And our religion does not prohibit that one. So for us to come one day to say that let us marry the idea of the Western world, to stop or to ask our populace, parents, not to marry any longer a girl at the child of 13, not until they have reached 18. But in changing that clause from 13 years to 18, that will be a problem for us. A lot of consultation has to be made. Islamic scholars' attention has to be called often. This is what we are doing, and at the end of which there will be a solution to this kind of problem.
The implementation of the VAP and Child's Rights Act is one step that will ensure that this menace is tamed. But when will this be? For sexual and gender-based violence to become a thing of the past in our communities, the journey may be a long one, but it certainly is achievable.